Good morning, everyone. Thank you for joining. My name is Yewande Mabulukoje. Can you confirm if you can hear me?
Yes, we can hear you. We can hear
Okay.
you.
All right. Thank you so much. Thank you so much. My name is Yewande Mabulukoje. I'm the country marketing manager for Shelf Life, a subsidiary at Field, and we are saying thank you. Thank you for joining us for what we believe will be one of the most important conversations that we will have this year. So every day in one country or the other in Nigeria, a mother bleeds to death after giving life. A family is broken, a community is shattered, and almost all the time, what is most shocking is that almost always what happened is preventable. The tools, the medicines, the knowledge, they all exist, but they exist on the wrong shelf, they exist in the wrong city, they exist behind a price tag that local providers cannot afford upfront. So this isn't so much as this isn't just a it isn't just a medical crisis. It's as much a logistics and access crisis. You see, stockouts are silent killers, but we are not here today to dwell only on the darkness of the problem. We are here because there's tangible hope and there is a solution. That is why us at Field, we have partnered with the wonderful women in FMCG and pharmaceutical sales for Africa. We believe that this collaboration will sensitize the women and the men in the pharmaceutical supply chain in all aspects, whether in the government, in the federal, in the primary healthcare centers, community pharmacies, with the community health workers, the midwives that help with birthing in local communities, to ensure that this image that we have on the left is the image that we'll always have and not the image on the right. So today we'll move beyond just the why, we'll move into the how, right? We are looking at how when we fix these stock gaps, we fix it, we fix the stockouts, we remove the delays, the gaps, we make what is required accessible at the right time without you having to drop money immediately through managed credit. And we'll be looking at that and how you can take actionable steps. So as much as the topic is urgent, we are here to talk about what next, what should we do, when should we do it, how should we do it, and if it's accessible, why are we not doing it? Right. So that's what we are here to do today. So let's begin. And we'll begin by, first of all, introducing the extraordinary people that I have on the panel for today to speak with us today. So I'll start with Jenny Opaleze. Jenny, you kindly introduce yourself, what you do, and yeah, then move on to person.
Thank you so much, Yewande. I am very honored to be part of this panel discussing these very important conversations, which not only affects the women, but affects the whole world in general. I mean, we are talking about maternal death. We are talking about women who are cut short in their prime because they are reproducing, because they are giving birth. We're talking about this burden of this disease. So it is something I am very passionate about. And I'm happy that today we are not just shedding light only on the problem. We have solution on board and we are shedding light on that solution, which if every one of us on this call puts hands together, I believe we can prevent this death that has been taking toll on us and causing devastation on families. My name remains Jennifer Obaleze. I am the co-founder of Women in FMCG and Pharmaceutical Sales in Africa. It's a community of corporate women in the FMCG space and the healthcare space in in totality, not just only pharmaceutical, where we come together to discuss what matters, how we can empower women, how we can advance women both in leadership and also put women in the forefront of the economy, in that way advancing the global economy, not just Nigeria, but Africa at large. So this partnership with field intelligence is something that is very dear to us as a community. It's something that we find very I would say valuable, and we are calling on everyone here to, pay attention to this. We'll be unpacking a whole lot today. Just like Yewande mentioned, these deaths are preventable, and it's more disheartening that it's just minor things that are causing these deaths, just supply chain gaps, stockouts. These are the things that, within the systems that can be fixed. So I'm happy on behalf of WIFPSA to be part of this and having this conversation. For me personally, number one, as a woman, is something I am very interested in discussing. And secondly, as a stakeholder in the healthcare sector, especially in Nigeria, I am happy to be part of this discussion, and I indulge you to sit with us while we unpack these conversations today. Thank you.
Thank you so much, Jenny. Thank you so much. And we are happy to be here with you as well. So let's go with Sheon. Sheon, can you introduce yourself, please?
Hi, good day, everyone. Great to be here. Thanks for the introduction, Yewande, and thanks for that very succinct background, Jenny. My name is Oluwaseun Ajayi. I work as the supply chain lead at Field Intelligence. I am in charge of the supply chain operations from our planning, procurement to our fulfillment, last mile deliveries, which include long haul and last mile deliveries to providers. Field Intelligence has been on this journey for the last 8 years, and we started recently, just last year, to focus on maternal health. And I'm happy to be here to just, join in the conversation and take action, and also, talk with other women and just share, all our ideas. So it's great to be here. Thank you.
Thank you so much, Sheon. Thank you so much. We have Waneka. We have Waneka here.
Thank you so much, everyone. I'm happy to be here today in the midst of intellectuals discussing this important topic about women. It's only right to say that women are the core of life. When everybody talks about life, if you don't talk about women, you haven't really started. So it's important that we all come together to see how we can reduce maternal mortality. When I was called upon to be part of the speakers today, it's something that's really got me excited, and I'm happy to be here. Waneka Egu, as you already know, my name is a sales consultant and a business strategist with a track record of driving measurable revenue growth. The founder of Nigeria Sales and IT Solutions, and what we do is that we optimize sales processes and close high-value deals while building long-lasting customer relationships. So part of the reasons why I am excited about this is that my company also supports the pharmaceutical companies who need our services, as the case may be. And then again, I've been in pharmaceutical for quite some time, about 12 years now. And I've also been part of the team that have tried to drive protocol around managing women and when anything concerning childbirth and reducing maternal mortality. So once again, I am happy to be here, and I can't wait to hear from every one of us here to see how much we can unpack the reason why women are dying, or why we are losing the women with respect to hemorrhage. Thank you.
Thank you so much, Waneka. Over to you, Mary.
Hi everyone. Thank you, Yewande. Thank you for this opportunity. I think everyone has said quite a lot, speaking to the reason why we are having this webinar this morning. So I will just quickly focus on introducing myself. My name is Mary Badmos. I currently work with Field as the procurement lead, where I'm using my extensive experience in supply chain management, and optimizing processes, creating strategic partnerships and innovations targeted at making sure that all of the products, and supplies that a mother needs is not just available, but that they're accessible in every corner of the country, and they're accessible at cost-effective prices, even both to the provider and then to the mother herself. I'm glad to be here, and I am looking forward to all of the great conversations we'll be having together.
Thank you so much, Mary. We had a long list of people that will still be talking with us. But so that we can get started, I would want to start with Mary since we stopped at Mary. I would like to talk with Mary. Mary, let's ground ourselves in the reality of this crisis of postpartum hemorrhage for the mothers, the nurses, the non-specialists in our audience that are here with us on the call, and I will still watch this recording, after. Can you describe what happens during a postpartum hemorrhage event? Why is it called the silent killer? And why is immediate access to supplies so critical?
Thank you, Yewande. So a very easy way to remember, or very easy term to use to describe postpartum hemorrhage, is to say that it is severe bleeding after childbirth. It's like that's a very just a layman way to put it. I mean, when we come to the health sector, there are different ways in which postpartum hemorrhage is measured, and then for certain associations, there are different definitions to what exact volume it is at which we say that a mother is hemorrhaging. But then, I mean, generally, it's just severe bleeding, occurring after childbirth. And then to answer the question as to why it's called a silent killer, it's because postpartum hemorrhage can start without any warning. I mean, there could be sudden onset after childbirth. There's also rapid progression, meaning that a woman bleeding within just a very short time, her blood pressure is dropping, and then when that happens, blood is not flowing to all of the vital organs that she needs, and then before you know it, the body is shutting down, and then of course death occurs, which is the reason why we are gathered here. That particular scenario is what we want to reduce as much as possible, almost to nil in our country, right? So for postpartum hemorrhage, we know that the key indicator to knowing that hemorrhaging has started is to be able to define what severe bleeding is. So how do we know that this mother has actually started bleeding severely? And that's why Field is introducing one of our key supplies in the PPH bundle that we've introduced, which is what we call the calibrated drips. So what that is doing currently is to remove that assumption, that we have when a mother gives birth, rather, as to guessing how much blood has the mother lost. So what the drape does is to give you accurate measurements. So if you were here, when the webinar started and we are sharing how to use the drip, you see how that there is a measurement. So you can tell when the blood hits 500 milliliters, you can tell when the blood hits 1 liter, and then the next thing is to start intervention immediately, right? But then if you can't tell that the mother is bleeding severely, then you cannot start intervention within a very short time. So PPH is not just a silent killer. It's a threat to every mother, literally. So it means that all of what the mother needs, the supplies, the product has to be accessible. It has to be accessible on time, meaning it has to be available right when the mother needs it. And I mean that's why we are here, right? And I know that as we go on, we'll begin to speak about, the products that that is used as intervention.
Yes. Yes. Thank you so much, Mary. I'm sure for some people, some of us in the comment section or some of us here will have had stories, one story or the other, either personal stories or stories of people that you know about. Please drop it in the comment section. It's something that we would like to feature after, or we can read out after. So the title of the webinar is What's Killing Our Mothers? We know that the clinical cause is postpartum hemorrhage, but we are going beyond the clinical cause because we are saying that the system is the problem. If what was available to be used for those mothers was available, then maybe it would have been preventable, right? So in that scenario, I'll call on Sheon. Now we are talking about, I'll call on Sheon and Jennifer, to talk about this. Can you elaborate on how distribution bottlenecks and cash flow gaps are killing mothers? So Sheon or Jennifer can go next.
Okay, I can go. So, I mean, the systems or the system, especially in Africa, most especially sub-Saharan Africa, is, the major cause of, this challenge. And, what makes up the system? Distribution and also cash flow. So distribution in terms of how do these medicines get to, the end user, the last mile, either the health facility or the pharmacies where the end user can, receive it. And then also for cash flow, how are these providers, these facilities, these hospitals, how are they, how fluid are they in terms of cash to be able to access, these medication as well? Because, the knowledge is there. I believe there might be some knowledge gaps in terms of the emerging medication, but in terms of the existing ones, the knowledge is there. So distribution systems in Africa, most especially sub-Saharan Africa, they are very fragmented, they are broken, right from, the manufacturer to when they get to the end user. So giving an example of, a medication that is, either with a distributor and, we have the facility, going to access this medication, there's already a challenge because their funding is limited. So for example, the public health facilities and the primary healthcare centers, which we all have in our various neighborhoods, in our wards, they have limited funding from their, facility purse. Out of that funding, they are meant to use it to, take care of their operations, their overhead, and then they also have to ration for, health products.
And the population of the country again.
Exactly. So when they go to, these markets, or even they go to their states distribution, drug distribution agencies, they have to, be very strategic about what, their choices. So that's, one challenge, because they tend to either not stock enough, and then there's a situation at hand where there's an emergency and this medication are not available, or they would sort of pick across board and because the limited. So that is for the public sector. For the private sector as well, there are also cash flow gaps as well, aside the distribution gaps. Distribution is global or sort of everywhere, but there are also cash flow gaps, just the same, in terms of funding, limited funding, having to ration what they eventually get. So this leads to stockouts. This leads to stockout. Oxytocin is not available. Drapes, heat stable carbetocin is not available. When it's needed. And I know one of the reasons why we are on this call is just to sort of spotlight or throw more knowledge on what can be done exactly to fix these gaps. Shelf life field generally is doing a lot in terms of providing credit, to these providers, so they don't have to ration and they can get exactly what they need, so they don't stock out. And we're also providing intervention in distribution systems. So we're also fixing the supply chain system, ensuring that these products are even available to be able to even be purchased. Working with providers in country to ensure that it's, available. So those are the major challenges with both the distribution side of things and the cash flow side of things are actually, leading to that, downward trend of eventually, mothers not being able to access, the life-saving medications that they need during delivery. So it's like a cascading effect, so to speak. Yeah.
Thank you so much. I would like to hear from Jennifer. Jennifer, with respect to the distribution bottlenecks, stockout gaps, how
Yeah.
are you seeing this affecting maternal mortality?
Yes, thank you for that, Yewande. And I think Sharon has really shed more light on it to create the insight. Honestly, we know that, supply chain, even all over the world, there are broken links. Unpacking the supply chain from end to end, from the manufacturer end to even the end user, that's the last mile delivery. There's an issue. Bringing it down to Nigeria, it has always been an issue we battle in the business world, trying to find ways to optimize supply chain, ensuring that we eliminate all the bottlenecks that would take the medication, especially in healthcare, from the manufacturer down to the patient that needs the medication. That's where you have all the access programs in partnership with governments, in partnership with private institutions, private entities, to see how we can make sure that this access is improved or optimized. So I'm trying to take a look at it. Imagine a mother who just gave birth in a hospital, maybe a rural hospital, and few seconds after giving birth, even after she held her baby or not even seen her baby, she starts bleeding. And then before you know what is happening, the bleeding intensifies. And before the doctors could do anything, the mother is lost within 2 hours because the right intervention is not there. Why is the right intervention not there? It's not like the doctors don't know what to do. It's not like the expertise is not there. It's because because of a stockout situation, just like Shehu mentioned. So I'm trying to imagine what would happen if this intervention we are trying to talk about now from Shield Life is available in rural areas, in hospitals, even community pharmacies. Now, I want to highlight the part for the community pharmacies because Sheun has mentioned what happens in the hospital. So I'm trying to look at it in areas. We know how it is in rural areas in Nigeria. Some hospitals don't even stock because they don't have funds from the government to even stock. So that is where the community pharmacies actually come into play. You see community pharmacies who are now more like the stopgap to ensure that all the medications required are needed. And then this pharmacist is not stocking the required medication because they don't have the financial capability to stock as much. There's so many diseases out there. There's so many patients who require a whole lot of intervention. Now, because the pharmacists have limited cash flow or limited finance, they are prioritizing what they are stocking. So in that way, they don't have the medication as at when is needed. The mother that needs the medication, the death cannot be prevented. So looking at it in a whole, you would see that that is one of the reasons why we even have this maternal death. So we need to find a way to plug this gap. And I'm happy with what the Shield Life team are offering us today. Something very simple, something that can be stocked in the pharmacy, something that can be stocked in the hospital. And beyond that, they are also offering the cash model. They are also offering, financial solutions in order to make sure that these interventions are stocked as at when needed and where they are needed to make sure that these deaths are prevented. So I believe that's what we are talking about today as we go into the webinar and we shed more light on these interventions. I believe that each person here would play a role to ensure that these bottlenecks are even, eliminated. Good thing is that we have community pharmacists who are our friends. We have no hospitals that are close. So we can shed more light, we can create this awareness about these solutions to them. Let them understand that even, to make it even better, cash is not an issue. So you don't have to buy cash. There are credit systems, there are solutions around it that can help you make sure that you stock these interventions and make sure that the mothers who need them get them. And we are, one way or another preventing these deaths, just like we've been mentioning. I don't want to start getting into the problem because we know what it is. Every day a mother dies. We don't want to talk about it. It's a lot, and most of them are from postpartum hemorrhage. So this is preventable. That is what is actually of a major concern to me. This is preventable. And when we are looking at it, it's not just the expertise. What is causing it is stockouts. So how do we prevent the stockout? That is why we are here. So thank you so much, Iwande. And I believe that as we are getting into the webinar, we'll get to know more about how the solution comes into play.
Thank you so much, Jennifer. So you and Shane talked about, very salient points. Shane talked about the fact that there are stockouts at the level of procuring the medication, buying the medication, getting the medication to the centers, and you also talked about the fact that it's preventable. There's a different situation when there's a problem but you don't know how to address it. And there's a different situation where there's a problem, but you know how to address it and you can handle it. And then now we are saying, okay, someone might say, oh, so all these things you are talking about, is it affordable? Can I get it? In my introduction, I talked about the fact that it exists, but it's in a different country or behind the price tag where the local provider cannot afford it upfront. But we are provided a model such that you don't need to be able to provide it upfront. And we are going to call upon a pharmacist here, a community pharmacist that has been working with us. We are moving into solution now. A community pharmacist that has been working with us to tell us about an experience that she has had, faced with when a patient needed one of those life-saving medications. Before I call on her, I'll use myself as an example. When I was working I'm a pharmacist. I did my internship at University College of Hospital Ibadan. And I recall that when we were there were several times when there was no electricity. And there were several times when there was no electricity. We had to use pure water to form ice block to ensure that we were maintaining the cold chain for oxytocin. There were times when the distributor that was supposed to supply misoprostol has not come. We had to run, for those of us that know Ibadan, there's Kuliara Pharmacy opposite UCH. We had to run to him to go and get from there. Several nights in the maternity ward that the father will have come very frantic trying to get some medications and it's not available because maybe the hospital is owing the supplier and the supplier has not come to deliver, and everybody's just praying that the mother will be fine. And then the doctor is saying, can you assure me that the cold chain of this oxytocin has not been tampered with? At any point in time, this block turns to water and you change it back to block. We can laugh about it. I experienced postpartum hemorrhage after delivery, and I can say, thank God I'm here today. Some people cannot say thank God that they are here today. But we are here waging this war against postpartum hemorrhage with accessible products and financing to ensure that does not happen, to erase that stigma. So I'll call on Pharmacist Nana. Pharmacist Nana, are you there?
Yes, I'm here. Good afternoon, everyone hearing me.
Good afternoon. So tell us about yours. You are one of our very experienced vendors, and you have joined this war against, maternal mortality due to postpartum hemorrhage. Tell us about an experience that you've had, and what are the actionable steps that you took?
Okay, thank you so much for this opportunity, and I appreciate the fact that a part of the lifesavers of women in our community. I run a pharmacy outlet in a community where you don't really have access to so many pharmacy outlets. So it's like 1 in 1,000 around where we have our own pharmacy outlet. So there's this private hospital, when you have a small community, there's always a particular private hospital that tends to be the key private clinic around that environment. So there's this particular afternoon while we were there, I can remember vividly when a woman came in with a paper that they should go and get drip. So, normally for as far as the hospital is concerned, when they run out of medications, just like Yewande mentioned, they always come to us like, please, we need this thing, we need plaster, we need bandage, we need this. So we like supplied the private hospital. So this particular hospital, they just wrote drip. So when they brought it, so I just told the pharmacy technician to just pick the normal drip. So they got back to said no. They now rewrote it. They said it's calibrated drip. Calibrated drip. So I had to now check like calibrated drip. So I had to call some of our distributors. They will let us pay in calibrated drip. What if we come along pay calibrated drip? Calibrated drip. So the person now said, oh, okay, no problem, fine. Like we'll check. So I had to also go online immediately. Thank God for technology. And immediately they said, calibrated drape. Calibrated drape is actually from shelf life. Lori shelf life now. Immediately I just called the person in charge. Like, come, which one is calibrated? It's part of their PPH bundle. I said, okay, fine. One of our hospitals here is asking for calibrated drape. They said they need it. That is something that I should make sure I have at all time, because they'll be sending some of their mothers to get it, and even the hospitals too. I don't know because shelf life, you have to be registered and all that. So immediately the guy said, oh yeah, Lori app, and I just entered the app immediately, and I ordered calibrated drape. Lo and behold, it was there for some time. So I was even wondering, like, are you sure? I mean, we are going to sell this thing. I can tell you that this thing has been of help to private institutions. To this particular hospital. I think there's a particular doctor that is working in that institution that actually calls for this. The moment they want to have delivery, if you don't have calibrated drape, the man will tell you, go and get it, or I'm not going to operate. So, sincerely, we want to thank the team working, because it's been since, with all that I've also heard today, no wonder, it's actually life-saving. And I got this on my managed credit account. Sincerely, I didn't have to pay for it. So if anybody is actually thinking that it is huge, I don't have the capital to start. If you are on shelf life, I think with your shelf life account, you can raise it. Then you pay you pay up based on your payment pattern or your payment agreement that you have with the company. So that has been my own experience. There was even one that happened that I think the woman wanted to deliver at 9, and we're supposed to close by 9 o'clock. So they just sent in one of their nurses to come in that please don't lock the door, don't shut the door. We need calibrated drape. So like they should just give us 5, that tomorrow we'll be setting out the bills. So that has been the partnership between us and a private institution that is around our vicinity, that you don't have so much private hospitals, or they don't even have access to the tertiary institutions around. So that's their first call when it's delivered. Thank you.
Thank you so much. Thank you so much.